our next guests today, our next guests are Brian and Kathy Wells. Welcome.
Well, thank you.
Thank you. Thank you.
Brian, Dr. Brian Wells, has been in this community as a doctor for, gosh, I don't know how many years.
It'll be 34 years.
And so you, Brian and Kathy, moved here from, where was it?
I was doing a family practice residency out in Kansas City, Kansas. And Lee, our daughter, she was 1 month old when we moved here.
Yeah.
And we moved in July 4th in 1982. So.
What year was it?
1982.
Okay, because that, let's see, okay, because you delivered Kate.
Yep.
So I was trying to think, now what year was Kate born? Kate was born in 84.
84, that's right.
Yeah, and everyone in Springfield was so excited because we were getting a new doctor. And I'm sure you were inundated the moment you got here with patients.
I think the first day I had like 14 patients. It was a crazy. I was very well. It went just super well to starting practice. So
yeah,
there was a need. You'd lost a couple of fine. Dr. Sims had died suddenly.
Right.
And you had Dr. Coe was still here, but he was here. But there was, and then Dr. Dickey was just overwhelmed.
Right.
And then Dr. Dixie Snyder was he was retiring, so there was a real need.
There definitely was a real need. And so I know we were recruiting doctors, and we particularly needed a doctor who would deliver babies.
Yeah.
Because we had no one at that point delivering babies.
No, you didn't. No, that's true.
So you came in as a general practitioner and brought your lovely wife with you and your little infant.
Yeah.
And Laura.
Yeah.
Laura was 8.
Yes,
and
she
Laura
was 8.
was 8.
Oh, okay. So I am mixed up. So you already had Laura, and she was 8, and then
Lee was
Lee.
big.
Yeah. Okay.
Yeah.
So, and you all been here ever since?
Ever since.
Ever since.
Yeah.
Yes.
And so there have been a few transitions. And Kathy, you helped. Well, now when the kids were little, you of course stayed at home.
Yeah.
But later, through the years, you got involved in the office and helping at the office.
Right. Yes. And then I help Brian now.
She's helping me now.
Now, yeah. Oh, I know. We're going to get into that.
Okay.
Because now, after and through the years, you know, you had your practice here, and you were affiliated with Springview Hospital, and then with Ephraim McDowell Hospital.
Right.
And then eventually you retired, which just about killed me. I just want you to know.
Oh, well, that happens.
I know it happens. I retired myself, so it's only fair that you should be able to retire.
That's right.
But, you know, you had been my family doctor and for all of my children and me forever. And so, yes, it was really hard when you retired, which was, how many years has that been?
It's been about getting close to 2 years. Maybe it's a little over 1.5 years now.
Okay.
Since I tried to retire. I tried.
And that's most interesting.
Yeah.
So now you retired, and I know initially you and Kathy were doing a lot of traveling, and I think you still are.
Oh, we still are. That's still.
Yes.
We have several places we're planning on going this summer and things like that. So we're still doing those things, but want to try to do things to help the community.
Right. So. Well, that's something you all both have always been involved in, and that is helping the community, and that is one of the things I admire most, of course, and because you've always wanted to make Springfield and Washington County a better place.
That's right.
And so then the next thing I hear, here you are traveling and enjoying your retirement, and then I get word that you've started this home care services.
That's right.
So now you're going to have to explain all that.
Well, it's called Homebound Physician Services, And basically, I just felt God asking me to do things to help those that are struggling. There's so many people that are in poor situations where it is so difficult for the family to get their loved one to the doctor's office. And you can imagine sitting in a doctor's office if they have some Alzheimer problems, or they're having some problem with ambulation or sitting upright and things like that. So I started this homebound physician services, and basically I see people that are having difficulty getting out, either after an operation or they've had a stroke and they're having home health coming in there, but it's so hard for the family to get them in the wheelchair, put them in the car, and take them to the doctor. And I work together with the home health agencies. There's 3 of them in our area, Visiting Nurses Association, and then we also have Intrepid, and also Community Home Health. And working with them, as well as seeing others without them, but the idea would be that I can help the family deal with their situation and just take a burden off them of having to get the patient to the office, whether it's their husband or their wife, or if it's their child. And I've just been really blessed by it. So
now, how does that work exactly? So do you get the referrals from home health, or can anyone contact you?
Anyone can contact me. It's not a problem. I accept all the insurances that are out there that most people have, of course, Medicare and all those, and I just try to work with the whoever it is. But most of my referrals have come from home health, where they've gone to a home and the family says, well, we can't get the doctor to fill out the home health papers. I can't get my dad there. And so some of the referrals come from the doctors too, doctors in Lebanon and Springfield and Bardstown. I've had referrals from them where they've had a patient that is having difficulty getting to the office. And so that's been so I get referrals from different sources, and it's been a blessing to try to help meet people's needs.
Is it just considered like instead of an office visit, it's a home visit?
That's right.
And so medical insurance pays for that.
Right. I have a bag that I can. It has everything in it that I need. All the diagnostic, even have some scales. I can weigh somebody. I can check their blood pressure. I can check their temperature, their oxygen levels, and blood pressure. All those things that you would maybe have done at the office. If home health is there, they can actually draw the blood for the patient, check their pro time if they're on Coumadin or blood thinners and things like that, and just work with the family however I can to meet their needs. That's so many of the patients are struggling. They need a hospital bed, and in order to get that, they have to have a face-to-face visit with the doctor. And that means that even though they went to see the doctor 3 months ago, Medicare won't accept a note unless they've been seen specifically for that hospital bed. They're sort of ratcheting down paying for the durable medical equipment because of the skyrocketing cost of health care. So.
Yeah.
And we were very blessed to also have like Pat's Pharmacy in Lebanon. I'm sure the pharmacies here are great too, but Pat's, they're really great with getting if we need a wheelchair or we need a hospital bed or bedside commode or whatever we need, they're very great about delivering it to the home.
Yeah.
And so because the patients can't leave the house to go pick up something because they have to be there, so Pat's is great about delivering
the
things
the equipment, yes.
And I suppose, Kathy, your role is you probably take care of a lot of those kind of technical problems, as far as.
Well, yeah.
Yeah,
mainly I just answer the phone, and then I'm there with Brian when he goes to all the places to see them, because I think it's important that we do this together, and that I'm there, and sometimes it's just the comic relief. Yeah. It's just something. But,
Yeah.
She's the hugger.
I was going to say.
She's the hugger. She makes people. She loves and hugs.
She provides the getting the family to feel some some relief and helping them relax and not be. I mean, you can imagine? I'm just sure how difficult it is to. These families are struggling to get their loved ones taken care of, and then so you're able to come in and do the medical part while you just take care of all the emotional needs.
Yeah.
That's right.
And and that means a whole lot to families.
It does.
Yeah.
It really does. That connection is that we're there more. It's more than just a medical.
Yeah.
We provide some emotional comfort to deal with whatever, because a lot of these people are struggling with end-of-life issues. There's the difficulties that family have. So, and
I call it wraparound services. That's what
good,
they call
Lisa.
in the medical. I mean, in a lot of the training and workforce, they're now all these days, or with welfare assistance. Anyway, everything I hear today is wraparound services. And so I kind of see that as this is the same kind of thing. You're not taking care of just the one issue with the patient's actual medical need, but you're taking care of the whole. It's a whole wraparound program with all of their needs.
yeah, because it's not just the patient; it's the family.
Yeah.
Some of these people, I filled out papers for the family. They FMLA papers, family medical leave. They have to be filled out by a doctor that is aware of the patient or whatever, and a lot of doctors don't want to mess with the paperwork, or they charge an arm and a leg for it. I'll fill out whatever papers that need to, so that if they need to be off to stay with their loved one that's going through a difficult time, they need to be there. And so filling out papers, it's just as important as seeing the patient, because it's a family. It's just how close. When somebody's sick in someone's family, the family needs to be able to be there for them. And so that's one thing I can do, is to fill out papers to make sure that happens.
And you probably find that once you go in there, as you say, it's not just the issue of checking on the patient and getting that, but there are a lot of other issues involved. So I bet you find that you're making calls and making referrals, and Kathy, I'm sure you help with that too.
Well, if they need to, I take messages and things, but if you need to be referred to somebody else, if they need to go have a surgery, if they need to go to the hospital to do something, he'll do that for them too, because it's hard. But sometimes they do have to go someplace for a knee replacement or hip replacement or something. So.
And do you refer to social services?
Absolutely.
Or community action?
We've actually had to. There are people that are struggling in their home. One of the most important things that we as doctors don't normally do is to see what it's like in their home. The home environment for some people is very, very poor. And sometimes that can point out to help the family deal with issues, hoarding, infestation problems, nutritional problems. Some people are financially struggling and they need financial assistance. We can talk to the home health people. They can come in and do financial assessments and try to help families get the needed supplies that they need for their loved ones. Because if you can imagine somebody's incontinent, they need to get their diapers, their Depends, their changes, things that you and I don't think about on a day-to-day basis, but for them, if they had to pay for it, it would just strap their money.
Oh, I do think about it. All those years of social work I did.
Oh, that's
That's
right.
If you'll
Yeah.
recall.
That's
And
true.
there are many times that I called upon you.
Yes,
Right.
that's true.
I
That's
can
true.
think of a case. One case comes to mind. I think about a elderly woman I thought would probably die if we did not. I think you helped me with that case because on my home visit, she did not. And the daughter was trying to take care of her, but the woman was malnourished. She was dehydrated.
Right.
You helped me on that case. I remember it very vividly because I ended up, getting her through your order, I think, getting her to the emergency room or something because her daughter was afraid to move her. And anyway, if we hadn't gotten her to the hospital when we did,
Right.
she would have died.
Right.
So, yes, I do. I'm very aware of those issues.
Yes, you are.
The other thing that's happened is that getting a doctor to come see you is a struggle. If you tried to call up a doctor and say, "Are you taking new patients?" a lot of people have a hard time. Well, we could see you in August, or whenever. It might be 2 or 3 months, but they've come from Florida or California or places to stay here with their loved ones because they can't take care of themselves. So we've been able to fill that gap of until they're seen by a regular doctor. My job is to act as a bridge at times. I've seen several people that have moved into the area and helped them with their diabetes, their heart problems, their health issues, and got them established that way I provide a service too. Somebody that doesn't have a doctor, usually it's within a week or so I can usually see anybody. And if it's an emergency, they probably will go to the emergency room. But if it's something urgent but can wait a day or two, I'll be glad to see anybody. So that way I offer that a benefit of acting as a bridge because it's the way doctor's offices, they only take so many new patients, and a lot of times it takes weeks or even months to see a new doctor.
And if they go to the other doctor, that's fine too. We just work with the doctor.
We work with. We're not trying to replace other doctors.
No, we'd only work with them.
Anytime if they have a regular doctor, but they can't get in to see him, I send notes to their regular physician so that they know, hey, I saw him and this is what we did. Because communication is critical with the home health agency and their regular provider. Because without that, you can't have that gap of communication so important. So if I see him,
So then will the insurance, like, some of these, insurances, PPOs and HMOs, you can only see you have a particular doctor that you're required to see, but will they pay for you also, those?
Actually, like Passport, if their local physician will authorize, I can see that patient just like a specialist, and I'll get paid that way. So if because they can't get into the doctor's office, if that doctor's agreeable to that, and I'll be covered that way. If that's but most people's insurance that are PPOs, most of them, I'm in the network. I've with all the insurances, so it's not an issue. It really hasn't been
an issue.
Not really an issue, really.
Oh, that is great.
Yeah.
So
then, how do people get in touch with you? I mean, I haven't seen.
We don't advertise.
I know you don't. Well, you don't want to work too much, so you get.
I want to go to Florida.
I was going to say that's going to interfere with some traveling now.
I'm sorry.
Well, I mean, you certainly deserve. To have your time off as many years as you have worked. So it's time, and I know you want to go to New York and visit your daughter there.
That's right.
And that's where you just got back from. Right?
From Brooklyn,
right.
yes.
Yeah, Brooklyn. Yeah. And she's got one.
No, Lee
children?
No, Lee is not married. She has no children.
Okay, that's right.
She just got promoted. She's now the education director at the museum where she works.
Museum of the Moving Image.
She's
It's
now
a
the
really cool
educational
place.
director there.
Yeah.
Okay.
So all the school kids from around the New York system come through there and visit that museum. And it's a very, very busy museum where they have all the history of movies they have a lot of old time movies. The last time we watched Was it a Lone Ranger?
Lone Ranger.
Like 1940s movie, you know, something
Oh,
that you would never.
White. In black and white.
Yeah.
You know,
Yeah.
but they also have new movies and things like that. But they're going to get ready to open up an exhibit on Jim Henson.
His family has given
They've donated a lot
majority of his things to the museum. And in October, they're going to have that, and that'll be awesome. You know.
Oh, yeah.
You know.
So
Leanne's taking care of all that.
And it's just like,
And-
mm-hmm.
It's just like, what?
I was just going to say, but the neat thing is like what Gary's doing right now is all digital, but in the old days they had these big reel-to-reels, and so they have all those older equipment that show how they used to do the news because they didn't have it digital. They had to send these big reels to the main studios or movies, and then they would show them. So the technology has changed, and they have all that old technology, how they used to show the World War II movie, how all these correspondents would get all their information. So it's a neat place to visit. So it was cool.
You
That
ought to
sounds
go
cool.
sometime.
Yeah, I'd like
So-
to.
You would
Yeah.
like it. It's great.
So that's where Leanne is, but now then your daughter here.
Yes, and
Laura.
she's a pharmacist, and she has
Oh, she has three.
and
Okay.
actually there's
There's
four.
four.
There's four now.
Oh, okay.
You know that situation.
Yeah.
Yeah, there's four, and we love them all.
Yeah.
And she's a pharmacist.
Yeah. And she's right here. Thinking,
Yes.
Where is she a pharmacist now?
Now at Walmart, now
Walmart.
in
At
Bardstown.
In Bardstown. Okay.
Yes.
So if somebody wants to get a hold of me, they can call 859-336-1247.
Okay.
And they can call that number, and they can get the information, and they can when they pick that up, there'll be someone that can help them get an appointment.
Okay.
Of course, I'm still in the
Is
phone
that
book.
some kind of
It's an
service that you have?
It's an answering service, and they have access to when I have appointments available. And they have access to that, and they put the patient in, and we'll help set that appointment up. And if there's some complication or something, I can always go in there and pick a better time or work with the person to see them. Because a lot of families work, and so I make some visits later in the afternoon or early evening, something like that, because it's so important the family be there when I talk to the patient, because sometimes they're hard of hearing, sometimes their memory is not quite so good. So I always encourage families to be there or have somebody there to make sure that they understand what they're supposed to do with their medicines, because sometimes I find that that's a problem for patients, especially older patients that are by themselves or trying to stay by themselves. So I try to work with the family as much as I do the patient.
Yeah. Yeah. Well, that's great. That's what I call good doctoring.
And that's something you can't do in your office. That's the thing about what I do is something that in the old days, I guess back in the 30s or 40s, most doctoring was at the home.
That's right.
So I'm trending back to what things used to be.
I was just looking at the Philip Sims museum that he was born in the house where Maple
Hill
Manor was.
Right.
That's where he was born.
Right.
I'd love to know who delivered that baby.
Well,
probably Dr. Hamilton.
Could have been easily.
Would he been?
Yeah.
Then?
Because Sims and Hamiltons were.
Well, Dr. Dickey's father was also a doctor here, and he went to homes and delivered babies. And Dr. Dickey did too. Probably when he first started out. Yeah.
I'm sure he did when he first started out.
Okay.
Yeah.
So I'd be curious to see because I never saw that until we looked at it.
Yeah.
So that's pretty cool.
Yeah.
Yeah.
And I know that I can remember when I was growing up in the 60s that there were still doctors then. In Bardstown, you wouldn't remember Dr. Wood probably, but I can remember him visiting my grandmother and making home visits. And that was in the 60s.
Yeah.
Yeah.
So, it hadn't been all that long, in my opinion. Of course, for some people that might sound forever, but
actually, what you should know is that back even when I first came in '82, since that time I've always made a few house visits, a few home visits, because it just made sense. And there have been some patients that just wasn't any way that. So a lot of the patients I see, some of them I've been doing it for 10 years.
Oh,
believe it or
wow.
not. But it's the idea of doing this on a I call it a part-time basis. It's something I really enjoy doing, especially with my wife Kathy. She is so supportive of it, and something that we can do together. When you think about retiring, you want to be able to do something that you can share and do together, and it's been a real blessing for us to do this.
Yeah.
And she's sort of a chaperone too, because I'm not going to go see some ladies by myself. So it's good to have for her to be there, and she's my second pair of ears because
she'll be able to see things. I always say, having been a social worker, it was always good when you had someone with you, because when you're talking with the patient, she can observe other factors.
There's nothing like having a woman's view of things, because we view it, even though being a doctor, a men's view and a woman's view is different. And I really, when she has a really good sense about what's going on. So it's been a blessing to have her along as my second pair of ears, eyes, and thoughts.
Yes, exactly.
Yeah.
Well, and now I have to ask this though. I know you've gotten into this quite a bit, but are you still working too? And you were helping in
Eastern Kentucky.
In Eastern Kentucky, I'm not doing as much. I'm trying to transition away so that I can see more patients in this area.
You were helping someone else out there, I know.
It's called Big Sandy Healthcare, and they've had two of the women had babies. And one of them had real high blood pressure and had to be on bed rest, and the other one already had a baby. And so I was filling in and helping, and then another nurse practitioner out there had back surgery. And so I was filling in, but I feel like it's time for me to be more serious about seeing patients here.
Yeah.
Mm-hmm.
And and another thing you had too was your clinic in Bardstown. Lebanon.
In Lebanon.
In Lebanon for you. I mean,
oh gosh, we did
that's been a long time, I guess.
Brookhaven.
Brookhaven Missions.
It was a mission there, the Brookhaven
did.
Mission, and I worked there in that clinic. Actually, we had an area set aside in a trailer there, and with the work of those people there, we were able to help some people with no insurance or underinsured.
Yeah.
And I did that for almost 10 years. And what triggered that was back in 96 and 98, I did some summer missionary work in Romania. And I saw all these people there that their blood pressures were sky high, they didn't have any medications. And I thought, well, I went all the way to Romania to do that. Why not do that here, here? So it was that thought was
Jim Fox. Do you remember Jim? And I'm Jim Fox.
Reverend Jim Fox, and I'm Jane Fox. He used to be a minister at Mount. I want to say not Mount.
It wasn't Zion. I don't know.
No, the Baptist church there.
I don't remember.
In Lebanon?
No.
Was it Lebanon though?
He worked at Brookhaven. That's what his job was.
Yeah.
That's where I sort of made that contact. But he had been a minister in the Washington County.
Oh, in Washington County he had been.
Okay.
Yeah.
And we met them, and he talked to Brian, and so he would go over there every other Saturday.
So.
And well, I didn't realize it was for 10 years you did that, but that was a part of your considered missionary work then.
That's right, and that was.
You did that for free.
I did that free. Never took a penny.
On Saturdays,
was it? On Saturdays, yes, every Saturday.
Oh my
every
goodness!
Saturday, yes,
every Saturday. So
amazing.
I've really enjoyed doing that, but there was a point in time when I felt like I had more people coming there to get drugs and illegal drugs and things like that.
And we don't do that.
I don't do that.
Yeah.
That's the only thing about this whole thing is that if somebody has, they're needing pain medication, it's unless they've got cancer, I'm not going to be able to help them. They'll need to go to whoever their family or a pain clinic, because that's not something I would be involved in. So you have
Well,
to,
I think that's a great idea
Well, yeah.
because we've certainly, as everyone knows, there's an epidemic
it is.
with an overprescription of pain medications and
and
causing a lot of addiction problems.
And now heroin addiction's a real problem.
Yeah.
Yeah.
So, and so, well, we'll make that
We need to
clear
wrap up.
on this program.
Yeah,
Don't be calling Dr. Wells if you think you're going to get some pain medication.
that's right. That's not what I'm about.
He
Yeah.
tells them.
And I have to put a plug in for something that everybody should have done, and it's everybody should have a fit test.
A fit test.
A fit test.
You probably have had one, Lisa.
What do you
well,
mean a fit test?
The fit test is it's a special test where they check your stools for human blood, and and what they're looking for is if there's blood in your stools, and the test is called a fit test. Then you need to have a colonoscopy. And I'm trying to support people because we've all known people who've had colon cancer who've died from colon cancer, and this fit test is so much more specific and so much easier because there are no false positives because it looks at human blood, not animal blood. You don't have to eat any special diet. You don't have to do anything different because
You don't do that fasting. You have to drink all that horrible stuff.
and you don't have to.
So it's better than a colonoscopy, is that what you're saying?
It is. If you have a colonoscopy, and then every 10, you're supposed to wait 10 if there's nothing. But in between that, once a year, you can do a fit test, and if there's any blood in it, it might be an indicator, hey, I don't need to wait 10 years. I need to have another colonoscopy because there's only two places that usually bleed in your stools would either be from your stomach or your colon. So if there's something going on, it's an early test. And if people are interested about it, they can go to a website. It's called kickingbutt.org. If you can see that.
Kickingbutt.org. Okay.
Just because I think one of the things as doctors we need to promote prevention because that's the leading problem is that people put off having colonoscopies or having their mammograms and things like that. And every year we know people who are dealing with breast cancer and colon cancer, and if we could prevent just one case by having their stools checked, that would be a blessing. So.
Well, that's interesting to know. I certainly didn't know that.
Yes.
Gonna get my kip test.
You just go to your local doctor and they'll give you one.
So it stands for fecal
Fecal
immunoassay test, and the immuno means that they've come up with a very specific test, and everybody can get it from their regular physician. If they can't, their physician needs to. They can go and find out about the fit test as well. But it's something that it's sponsored by throughout Kentucky. It's something that we're becoming more aware of this testing and promoting it through the American Cancer Society, and doctors in different areas are all encouraged to be a part of that. So.
Well, and we all know that we have such a high rate of colon cancer, so, and it's deadly, so.
It's deadly because a lot of people, it's gotten much more severe than before they know they even have it. All of a sudden, and if it's metastasized outside the colon, we don't have any good chemo or radiation or treatment. So early detection is the best treatment.
Is the key, that's
Is the key.
right. So everybody in the listening audience, go get their fit test.
That's right.
And if you need if you need a home visit and you need to see a doctor, then call Dr. Wells and Kathy.
That's right.
And that number is 859-336
1247.
1247 1247.
Uh-huh.
So, this is certainly a need that we have in our community, and I'm really glad that you all are doing this, and I'm just, it's a wonderful thing, and I know it's probably saved lives already and will save lives, so, and certainly is a blessing to our families and community.
Thank you.
Well, thank you so much.
Thank you all for being here.
Thank you for asking us, Lisa. I really appreciate it.
Thanks so much. It's great.
You're
But
welcome.
now, happy travels too.
Oh,
We're leaving in May for a couple days.
Yeah, great.
yeah.